Dear learners, now in this section we will study definitions of functional foods and nutraceuticals. Functional foods are found in many fruits, vegetables, grains, herbs and spices to provide a health benefit, lower the risk of certain diseases or affect a particular body process. There are different terminologies used for functional foods such as nutraceuticals, designer foods, vita foods, pharma foods, medicinal foods, prescriptive foods, therapeutic foods, superfoods, foodaceuticals and medifoods. There were no universally accepted definitions for nutraceuticals and functional foods till 2017, although commonality clearly existed between the definitions offered by different health oriented professional organizations. But finally, in 2017, Functional Food Centers USA defined functional foods by providing clarity and a more comprehensive understanding of its meaning. In this module, we shall study the definitions of functional foods and nutraceuticals given by different health oriented professional organizations. According to the International Food Information Council IFIC, functional foods are foods or dietary components that may provide a health benefit beyond basic nutrition. The International Life Sciences Institute of North America ILSI has defined functional foods as foods that by virtue of physiological active foods component provide health benefits beyond basic nutrition. Health Canada defines functional food as similar in appearance to a conventional food consumed as part of the usual diet with demonstrated physiological benefits and or to reduce the risk of chronic disease beyond basic nutritional functions. The Nutrition Business Journal classified functional food as a food fortified with added or concentrated ingredients to functional levels which improves health or performance. Functional foods included enriched cereals, breads, sport drinks, bars, fortified snack foods, baby foods, prepared meals and more. Now the American Dietetic Association states that functional foods include whole foods and fortified, enriched or enhanced foods have a potentially beneficial effect on health when consumed as part of a varied diet and on a regular basis at effective levels. On the other hand, the American Council on Science and Health states that functional foods are whole, fortified, enriched or enhanced foods that provide health benefits beyond the provision of essential nutrients when they are consumed at efficacious levels as part of a varied diet on a regular basis. The National Academy of Medicine, formerly called the Institute of Medicine, states that the functional foods are those in which the concentrations of one or more ingredients have been manipulated or modified to enhance their contribution to a healthful diet. In Japan, the FOSHU organization states that functional foods are processed foods containing ingredients that aid specific body functions in addition to being nutritious. Finally, the Functional Food Center, that is Functional Food Institute FFC USA in 2017 defines functional foods as natural or processed foods that contain biologically active compounds which in defined, effective and non-toxic amounts provide a clinically proven and documented health benefit utilizing specific biomarkers for the prevention, management or treatment of chronic disease or its symptoms. So far we have seen the definitions of functional foods. Now let us see how nutraceuticals have been defined by the several health oriented professional organizations namely the Foundation for Innovation in Medicine, Nutrition Business Journal and Health Canada. The term nutraceutical is a hybrid or contraction of nutrition and pharmaceutical, as we have seen earlier that it was coined in 1989 by Dr. Stephen DeFelice, who established the Foundation for Innovation in Medicine in 1976 in New York, US. Dr. Stephen DeFelice defined nutraceutical as any substance that may be considered a food or part of a food that provides medical or health benefits, including the prevention and treatment of disease. Such products may range from isolated nutrients, dietary supplements and diets to genetically engineered designer foods, herbal products and processed products such as cereals, soups and beverages. On the other hand, Health Canada states that nutraceuticals are a product that is prepared from foods but sold in the form of pills or powders, potions or in other medicinal forms not usually associated with foods. A nutraceutical is demonstrated to have a physiological benefit or provide protection against chronic disease. The Nutrition Business Journal states that it uses the term nutraceutical for anything that is consumed primarily or particularly for health reasons. Based on that definition, a functional food would be a kind of nutraceutical. In India, nutraceutical are the food components made from herbal or botanical raw materials which are used for preventing or treating different types of acute and chronic maladies. Since functional foods have also been known as dietary supplements, let us now see how Dietary Supplement Health Education Act DSHEA in the United States has defined it. The DSHEA formally defined dietary supplement using several criteria. A dietary supplement is a product that is other than tobacco that is intended to supplement the diet that bears or contains one or more of the following dietary ingredients like vitamin or mineral, and herb or other botanical and amino acid, a dietary substance for use by man to supplement the diet by increasing the total daily intake or a concentrate, metabolite, constituent, extract or combinations of these ingredients. It is intended for ingestion in pill, capsule, tablet or liquid form. It is not represented for use as a conventional food or as the sole item of a meal or diet. Is labeled as a dietary supplement. Dietary supplement includes products such as approved new drug, certified antibiotics or licensed biologic that was marketed as a dietary supplement or food before approval, certification or license unless the Secretary of Health and Human Services waives this provision. In this section, we have studied definitions of functional foods and nutraceuticals as given by several health organizations. Dear learners, let us conclude. Functional foods are generally linked to health promotion. The physiological effects of functional food or bioactive compounds may vary, but their categories of action include physical performance, cognitive, behavioral and psychological function, organ or organ system function and combating chronic disease. In this section, we have studied the definitions and history of functional foods and nutraceuticals. We have studied that the term functional food was born in Japan and Japanese were the first to observe that food could have a role beyond nutrient supply. Japan was the first country to legislate these products as foods of specified health use. Europe and American countries incorporated later the concept of added value of food. We have also seen several definitions of functional foods and nutraceuticals given by several health organizations. But in 2017, Functional Food Center of Functional Food Institute USA has developed a definition of functional food to provide clarity and a more comprehensive understanding of its meaning. So, Functional Food Center, it defines functional foods as natural or processed foods that contain biologically active compounds which in defined, effective and non-toxic amounts provide a clinically proven and documented health benefit utilizing specific biomarkers for the prevention, management or treatment of chronic disease or its symptoms. Nutraceuticals has been defined as chemical components of food when ingested in appreciable amounts demonstrate attributes such as good availability, bioefficacy and exert positive effects on health characterized by disease prevention and alleviation. Thank you.